Hi, everyone. My name is Siang Lim from the Harvard School of Public Health. I'm here to talk about why similar policies resulted in different COVID-19 outcomes. In the first year or two of the COVID-19 pandemic, there was huge variation, over 100 times, in COVID-19 mortality rates between countries. Yet most countries were dealing with the pandemic in similar ways, with lockdowns, school closures, social distancing, and so on. So why did some countries have far more deaths than others? These seemingly obvious factors like wealth or healthcare capacity or even age, we find these things do not explain most of the differences in death rates. So what does? To understand this puzzle, we use the simple pandemic model with one crucial modification, where people take steps to reduce disease transmission in response to the perceived risk of death from COVID-19. So think about an outbreak wave. As the infection spreads, case counts rise, followed by hospitalizations and deaths. And as the situation worsens, eventually governments and people respond by taking steps to reduce transmission. And that curbs disease spread and the wave subsides. Eventually, memory of the threat starts to fade, interventions are relaxed, and that sets the stage for a new wave to begin. We fit a model that includes this behavioral response to data from over 100 countries, and what we find is that differences in mortality rates are primarily due to how sensitive different countries are to the threat of COVID-19 and how readily they respond. Ultimately, every country ends up in this sort of dance with the disease, taking just enough steps to control transmission when it gets out of hand. Now, crucially, those steps taken like social distancing or school closures are similar across countries. That's because everyone's dealing with basically the same disease, which requires more or less the same control measures. What differs, though, is how responsive countries are to the threat, how readily they take action. More responsive countries act faster at lower death rates, resulting in fewer deaths compared to less responsive ones, even though the interventions that each may adopt are ultimately going to be similar. We find that countries vary widely in responsiveness and hence in mortality outcomes. We also find that responsiveness correlates with two cultural constructs, openness to novelty and power distance, but it's not a purely cultural phenomenon. So these findings yield an important policy implication. Greater responsiveness to outbreaks saves lives without necessitating more severe control measures, because you cannot ignore an outbreak. One way or another, you'll need to respond eventually. So it's better to do it sooner, to do it more readily, and thereby save more lives in the end.